Hey guys, Dr. Kilfoil here with another Onychodebridement video. Onychodebridement pretty much means that we're just going to be cutting nails. For some reason, people like to watch this stuff, so here you go. What we're going to do is we're going to describe exactly what I'm thinking so that if you ended up having to clip your grandma's toenails, you can, learn a little something from this. Anyway, let's start this video. We have this patient. We got to check the pulses. We got to make sure that this patient has good pulses. If the patient is complaining of pain in their toes, that could be some peripheral vascular disease. So if they have poor pulses or no pulses at all, it might be a sign that you should go see a podiatrist and not try to cut these things yourself. I also do the capillary refill time, which is when you press onto the skin, you count how long it takes for the red color to come back from its blanched color. I'll show this in more detail in another video. But here we go. Let's get started. We're going to use alcohol, and we're going to make sure that this area is sterile. So if we do nip the skin, it's not a filthy environment, which is automatically going to get infected. So we use the alcohol. Here I'm using a nipper. Now the principle that what I think about when I'm nipping these nails is that, imagine before we had metal, humans still had, nails that were long. How did they get rid of them? Well, you just go take a quick run through the cave, and you're going to notice as you're kicking through the sand and the other crap that's around in your unshod environment, you're going to grind down your nails down to the tip of your toe and no further. You're not going, so with the nipper, you're not going to go any further than the tip of the toe. Pretty much just cut them straight across and resist the temptation to cut the corners, because it feels like, I can really grab this corner really easily. Let me do it. This is a good way for you to encourage an ingrown nail or accidentally nip your grandmother. So do not do that. Cut straight across and just go. See, look, so I'm just nipping across. Here I'm using my favorite nipper. This is made by Bianco Brothers. This is their Excelsior one. I like this one because if I do need to get in the corners for a actively symptomatic ingrown nail, that's what I use because it's so narrow at the tip. It's a little sharp, so it could actually end up stabbing somebody, so you got to be very careful when you're doing it. Here I'm using this burr. This is literally the same thing as a Dremel. I don't recommend you going to Home Depot and getting a Dremel yourself with the kind of tip that this thing has, because you're going to be sending these fungus nail debris particles up into the air. It's going to get down your shirt. It's going to give you ringworm on your back or your scalp. It's not a very sterile environment. We use a vacuum attachment, so it's sucking up all the dust as it comes out, and even with the vacuum attachments, it's not getting it all. It's actually kind of gross. Don't do it. But the same principle applies here with the nipper. I'm not going to be pushing too hard. Pretty much all I'm doing is making sure that Grandma doesn't rip her pantyhose when she's leaving my office with the sharp talons that she came in with. Pretty much what I'm doing with this Dremel burr is I'm putting a chamfer. That's a carpentry term, a chamfer, which pretty much just means that you're taking a 45-degree edge off of the nail, and that kind of gives like this French manicure type of look to it if you know what you're doing. So I just kind of, I want to do a good job by my patients, so I give them the best job I could do, and that involves a chamfer on the tip. When you do a chamfer, you can leave a little bit of these little straggly bits, and then so I'll come back with the nipper and get any of the little hairy little pieces of nail that's left behind. Here you can see I'm using the Dremel on some of these corns and calluses, which I probably already. You'd want to hit them with the scalpel first, but not if you're an amateur. But it goes to show you that this Dremel is actually pretty forgiving on hard hyperkeratotic skin. On soft, thin, crappy skin of grandma, especially if she has any kind of peripheral vascular disease, you don't want this to touch any part of her toe. Again, don't get a Dremel to do your grandma's nails. Just get one of your Amazon podiatry nippers. Make sure she has pulses. If she has diabetes or peripheral vascular disease, have a podiatrist do it. Here I have, here's my scalpel. Gets a little corn. Grandma's feeling good, and she's going to come back and she's going to tell all her friends that this doctor is, takes care of her. And then one day, I'll actually have a real problem. But in the meantime, this keeps the lights on. And, maybe it might be the most humbling thing that I do during the day, but I don't care. Medicare's paying me $60 to do this. Find me another thing I could do that takes 10 minutes and make me $60. You know what? Don't answer that. Anyway, thanks for listening. Podiatry Explained. Dr. Kilfoil. Have a great day.